Hello, my name is Caroline Sogomo. I'm a registered nurse. Today we will continue on Nclex prep from right where we left off last time. Hello, welcome to my channel. Today we will be continuing on part 3 of reproductive issues in preparation for Nclex, and we will pick up on chlamydia. So today we're talking about STDs and how it affects both the mother and the baby during pregnancy. Now, the first one is chlamydia, and chlamydia is one of the #1 in the United States transmitted in form of STD, followed by gonorrhea. Now, both of these diseases are treated with antibiotics. They are detrimental to the well-being of the baby during childbirth. Most of the time it affects them during childbirth as they're coming out, because their chances of them getting infected are much higher during that time. Now, they are both treated with antibiotics, as I said. Now, during childbirth, especially vaginal delivery, the child passes through the vaginal canal, and that poses a risk because if they expose their eyes, they can get infected with neonatal conjunctivitis, or it's also called ophthalmia neonatorum. Now, that is treated with either a cycline medication, so for example, tetracycline or erythromycin, but you have to administer it during a set time. That first dose has to be administered within the first 1 hour of childbirth, and most of the time the baby ends up getting that in the nursery together with vitamin K. The other thing we will talk about is herpes simplex type 2, because there are two types. There's type 1 and type 2. The other name for that is genital herpes. Now, with this kind of infection, it is treated with antiviral medications, unlike antibiotics like earlier on. Now, with antivirals though, you need to know that viral infection, when you take the antiviral medication, it will not heal you like antibiotics, because antibiotics targets the bacteria and ends up killing the pathogen, and eventually it comes off of your system. However, when it comes to antivirals, they only manage the symptoms and therefore end up putting the infection into remission. So that does not mean it comes off of your system. It just helps your immune system fight it by building antibodies against it. Now, should you ever get immunocompromised again, then it is bound to come up again in your system. So when it comes to that, we need to know that when the child is born and gets exposed to herpes, they stand 50% chance of getting it from the mother. Okay, now if a baby ends up getting herpes simplex type 2, they stand a 90% chance from it if they get it, especially if they get it through cesarean section. So this is very, very detrimental to the well-being of the child. And the other thing that we need to discuss will be candida. It's also called yeast infection, or when it affects the child, then it ends up being thrush, and that is observed in the tongue area. When you expose the child's tongue, you will see it as a coating on the tongue. It's normally like whitish in color, and it fills out the tongue, and they end up getting antifungal medication, something like nystatin solution or mycostatin solution for that one. Now, we are going to move on and talk about genital warts, or the other name is condyloma acuminata. Now, this one is also called HPV. Now, I do know that they do have vaccines for HPV, but you have to be within a certain age range. I believe you should not be, is it more than 28 or 26 to get it? But HPV is an antiviral infection. Now, when it comes to that, it is treated in different ways for the mother. Now, when they do pap smear and they find abnormal cells, then they get to biopsy those cells and find out whether they're benign or whether they could be cancerous. Now, sometimes it ends up being treated with either antiviral medications, anti-tumor medications, or they can either cauterize it or freeze it. It just depends with how aggressive it is. And we will go deeper on this in another video. The other one that we will discuss will be syphilis. Now, I want you to know that syphilis is a blood-borne disease, and other than that, the reason being is it affects the placenta during the first 16 weeks of pregnancy. And it has the bacteria for it is called spirochetes, or it's spiral shaped, and it's twisted, and so that bacteria can go through the placenta and go ahead and infect the baby. Now, again, I cannot stress this enough, it hits the baby at week 16. And I know you are wondering, why is it that it affects the baby at week 16? Because at week 16, that is the moment when the placenta gets fully developed. So it will attack or get into the placenta before it becomes the real deal, or the final product of it that will carry the pregnancy through to 40 weeks. You always attack your enemy when they're weak. Okay, and there are two types of syphilis, or basically there are two stages of syphilis, and there's the primary one and the secondary one. So for the primary one, that is also called like canker, and that's when you have a sore or a lesion-like thing around either the tip of the penis or the labia of the vagina of the lady, and that is normally treated with penicillin kind of medications. Now, if it's not managed, or if it doesn't go into treatment, then it will go to a secondary stage, and that one gives you flu-like symptoms. And so it is very important to try and manage it, because what happens is now it starts to spread to other organs of your system, and if you don't treat it, it's something that will show a symptom and come and go, that kind of thing, and if you don't treat it, then it will end up going to affect your cardiovascular system, your brain system. It can cause you a lot of neurological problems and things like brain aneurysm. So it is something that you have to address them or get treated early. So it's very important to limit the number of your sexual partners, or if possible, abstain. Thank you so much for your time. We will continue on part 4. Look out for the part 4 video, and on that one we will discuss the breast cancer in terms of Nclex prep for it. You can always Follow us on Facebook or YouTube, and the name for that is Nclex Conquering Warriors. Thank you so much for your time.